Hello, nurse leaders. Today we're going to be discussing identifying research questions. Last week we talked about the beginnings of this concept of identifying research questions. We talked about the P-code format. We're going to be discussing it some more today. And we also talked about different types of research designs, as well as prior to that class, we talked about different forms of hypotheses. We're going to go over much of this information again today in greater depth, and I look forward to learning with you. So the learning objectives are we're going to discuss ways research problems are identified, discuss relationships among the purpose statement, the research problems, and the research question. We're going to differentiate among associative, causal, simple, complex, non-directional, directional, null, and research hypotheses, which we'd already gone over earlier. We're going to use criteria to appraise research questions. We're going to identify independent and dependent variables. We're going to define mediators, moderators, and confounding variables. And we're going to discuss how research, evidence-based practice, and quality improvement differ. And we're going to describe the P-code method and discuss ethical issues associated with the development of research and evidence-based questions. So, how are clinical problems? How do clinical problems guide research questions? So many of you have already started looking at this when you've been developing your own research questions. You took topics of interest from you based on your experiences and interests. So the primary goals for conducting nursing research are to generate new knowledge that has wide application to promote positive health outcomes for a particular patient population. And we've discussed how we look at vulnerable populations. We also look at being able to serve all populations. And so we want to look at enhancing quality of care and enhancing outcomes of care through the use of evidence-based practice and doing these research questions. We are also adding to the body of nursing knowledge that we have. And this now gives us answers to clinical situations that we have. We want to enhance the overall quality and cost effectiveness of care. We're going to improve the healthcare delivery system, and we're going to validate the credibility of the nursing profession through evidence-based practice. In terms of looking at using evidence-based practice, we use evidence-based practice to provide excellent care. How clinical problems guide research questions is it identifies nursing research problems. And a research problem is an area of concern where there is a gap in knowledge that requires a solution that can be described, explained, or predicted to improve nursing practice. So when we're doing the review of literature, we're looking at the literature that's out there and we're saying what information is available and where are there gaps in the information. What questions do we have that are not being answered by this? There was a student who asked me, what if I'm doing a search and I can't find any information to my question? So we talked about looking at related concepts and topics. But in terms of looking at this is an area where there's a gap in knowledge and would be an excellent area to start to look at. Research problems are identified in numerous ways. Either through clinical experiences, such as you've had in your clinical experiences as students, or actually other types of clinical experiences that you're going to be having in the future, please God, as nurses. Professional literature, which is the review of literature. That's where we look at scholarly literature, peer-reviewed literature, and that was discussed last week. Nursing theories. Nursing theories help us in terms of directing the research. We talked about how nursing theories help in terms of directing the research. They tell us variables to help us in understanding what variables to be looking at. And also nursing theories help us in terms of being able to help us with our practice as well. previous research that's been done that we've read about and that we say, oh, this is an area of interest. Some of the articles that you have selected are excellent research studies, and they relate to the PICO questions that you are interested in, and you're going to be able to build on those research studies. And then national initiatives. So for instance, NIH will say, the National Institute of Health, we have an initiative this year that we're going to be funding these topics. These are areas that we're going to be focusing on for this year. So that could be a national initiative. Identifying research problems. So you're going to be looking at clinical experiences. So nurses observe something in clinical practice. For instance, we use the discussion in terms of decubitus ulcers, right? So that when you have patients that are improving only 72%, and you really want to say, gee, what is there a better way to be able to do this? So you're going to start to now have a question in terms of improvement of decubitus ulcer care. Questions, there is a different or better approach. If there's insufficient evidence, so we need to conduct research, right? Professional literature, we're going to read articles. They may identify gaps in knowledge or insufficient evidence. And what is the insufficient evidence? And only one or two, publications, which are not at a high level, but you want to be looking at, things that are from level 1, level 2. Case studies are a report of a single or unusual event in clinical practice. There could be small pilot studies. These are, and pilot studies of a new intervention. They're also going to be a smaller study. We're going to talk about sampling in terms of the number of people that you have included in a research project next week. But in the reading guides, I've already given you reading guides to help you in terms of obtaining that information for us to be able to discuss in class. And also, if you look at the McFarland article, when you look at the McFarland article, it helps you in terms of identifying how we know in quantitative research, not qualitative research, quantitative research, how many subjects need to be in the study for it to be generalizable and to have reliability and validity. So we're going to be looking at each of those articles. I've posted questions for the articles that you'll be able to look at them and to have a better understanding of how subjects are obtained for studies, and also in terms of understanding study sizes. So you want to be able to look at the literature and see what's out there. It would be wonderful if every topic had research studies that were at level 1 and level 2. That's not always the case. And sometimes it's really that you're only going to have these small pilot studies, and then you're going to build on them. You could do replications of those studies as well. So you want to be able to get data that is generalizable, and that you can really generate outcomes and see if the outcomes of the intervention are to the level of significance. So when is there sufficient literature and the knowledge? It's considered generalizable. What does it mean to be generalizable? Remember, I told you if everybody stood up in class, you're all around the same age, or you're all nursing students, and are you going to be the same height? No, there's going to be variability that exists. So we want there to be variability in our subjects as much as possible, but we want it to be able to relate to the general population of the target population of the group that we are looking at. Okay, so if I'm looking at 15 to 17-year-old adolescent males with type 1 diabetes, right? So if I'm doing a study in them, I wanted to, hopefully I'm able to get a randomized sample. That's, remember, where you put everybody's name in the hat and you pick them out. Of course, we nowadays have computers that generate tables. We don't put all the names in the hat. and that means that anybody could be part of the intervention group, the experimental group, and everybody could be part of the control group. It's not that I have a bias and I say, oh, you're the typical, you're the typical, you're the typical, but there's no bias in terms of that. So when there is sufficient literature, the knowledge is going to be more generalizable because you're going to be able to look at it and have more information. So you're going to be able to generalize it to that target population that you're looking at. And you want to look at, and here it says, the results of a study are applicable to a wider population. Systematic reviews, that's filtered evidence. These are articles that synthesize a large amount of evidence, a body of knowledge on a topic. They review it and publish a more concise summary with multiple studies about the topic. Remember, I told you that the study that we've done on burnout in pediatric hematology oncology, on decreasing that, the international study, that there was somebody from West Point who was doing a review article. I think he had 100 studies on burnout. And if you look up that study, you will see that they have a table there that identifies it, and then it synthesizes all the information from all those studies. So the sources of research questions continued are current nursing theories, and theories help to explain a phenomenon. So when you look at a core concept that's there, they articulate what is related. So there are grand theories. Grand theories look at the fundamental aspects of nursing. So when we talked about the meta paradigm, we talked about what are the identifying factors in terms of nursing. We talked about person, environment, health, and the nursing process itself. So identifying what nursing is. So these are the key phenomenons that help us identify what is nursing. So grand theories are going to articulate the concepts and the definitions and the assumptions and the propositions. They're going to look at all of these in relation to the phenomenon that the theory is about. And they're going to describe and explain it. And remember, we talked about how theories help us predict what's going to be, right? We looked at grief theory. It helps us in terms of understanding what takes place, what are the interactions, and what are the outcomes. Middle range theories have more focus to the profession, and also we're able to do research studies with them. And also we do theories to test, we do research to test theories in the real world. So we want to know, are these theories reflected in the real world? And do they actually represent the phenomenon of the real world? And we're going to do a research study. So actually, we develop theory using grounded research studies, and we also are going to test theories. So numerous U.S. agencies identify health problems and establish that. There's and establish national research priorities. So before I gave you the NIH as an example, there's the Surgeon General's office. You could look at a recent report from the Surgeon General's advisory on our epidemic of loneliness and isolation. And certainly during COVID, that was exacerbated tremendously. And still, on the one hand, it might seem more convenient, not everybody going into the workplace, but it also increases loneliness and isolation. There's the NIH, the National Institute of Health, National Institute of Nursing Research, the NINR, and other government institutes. Other national initiatives such as Healthy People 2030, they identify the areas that we're going to be focusing on in terms of health promotion. And they say why research is needed and what are the goals of the research studies and the objectives. And you submit an abstract and a proposal of the study that you are interested in. And they also release grants that are available. There's the Agency for Healthcare Research and Quality. And that's a federal agency that's devoted to improving quality, safety, and delivery of healthcare in the country. And that also, it articulates standards for safe, effective care, health promotion, and management of chronic conditions, among other things. So remember, we talked about having clinical practice guidelines in terms of looking at the gold standard of care. And it collects data, it publishes reports, it creates and publishes clinical practice guidelines, which are evidence-based recommendations for the management of specific patient conditions. And you, for your topic, you're going to be choosing one clinical practice guideline, and you're going to be looking at that in terms of the process of care. And these guidelines are available about everything that relates to clinical care, such as hand washing, falls. It's a fall prevention guideline, UTIs. I mean, you look it up. You look up the database, and you're able to find it. And you could also look at several databases and look at them. Actually, in my graduate class, one of the assignments that I had the students do was to look at 2 different databases and to develop a clinical practice guideline based on those 2 databases, clinical practice guidelines that they could use in their institution. And I have to say that one of the students in the class actually was part of a study that did this, and they changed the procedure in their institution to decrease certain risk factors that they had in terms of blood drawing from central lines. So nurses are part of this process. You are going to be a part of your process. This student did this with her bachelor's. She was not master's prepared. And this is something that you could all become involved in. And you now have the eyes. You now have the knowledge to be able to look at things and to start thinking about these in this way. So the clinical problem is also called the research topic. So they're broad. You start off very, very broad, and then you're going to narrow it down to exactly what you're going to investigate. And you're going to look at a particular aspect of the problem. So in terms of thinking about a topic, you want that the researcher has a strong interest on this topic. And you know that at first I asked, what are people's interests? And I grouped you together. So hopefully the topics that you're working on for your poster, you have a passion and a great interest for. The research requires significant time and effort, as you are finding out. And the significance to the body of nursing knowledge. So time and effort has to be devoted to something that's clinically significant, not that something is not significant. If you're asking me $1 million to do this research study, it has to be something that's going to be significant and that's going to be useful to the body of knowledge. So you also want to think about what's the scope of the problem. Does it have a large effect on a large number of people? Does the result of the research have potential to improve care for a large number of people? So you want to look at statistics. What's the incidence of this problem? How much does it cost? How many days of work are missed? How many days of school are missed for children? So you want to be able to look at the data that's out there. And the CDC has a lot of data if you're having problem finding it, that you could be able to find information. And the feasibility. You want to look at required resources, personnel available, who can participate, can people be participants, and how are they going to be recruited? So you have to think about what resources are available to you, and what is needed in terms of personnel. Is there going to need to be release time? Are we going to be able to have coverage? Are you going to be able to offer the same level of care? So all of this needs to be looked into. For instance, when we were doing our study on decreasing burnout in pediatric hematology oncology, we set up the first round was a mindfulness meditation model, but we shortened it so that it could be done at change of shift. And that way we could provide for that hour that they were having that the staff from the shift before stayed over. And then we did it also in the other direction. So that way we had the number of personnel that were needed to be able to care for the patients. And ethical considerations. We always have to be looking at our code of ethics from the ANA and to make sure that the key issues are autonomy. What's autonomy? That you have the right to choose, right? whether you want to participate or not. And also you also are able to leave the study at any time. Beneficence is that it's only going to do good, and justice is that you treat everybody equally. So you want to make sure that the design is ethical and that it doesn't have any undue risk on participants. And we talked last week about studies that were done that were not ethical. And we also talked about the threats to reliability and validity that exists as well. So when we're doing a research study, we're looking to see that the intervention is what caused the outcome. But remember, there were other reasons that it could happen. So we always want to be looking at that. And sometimes we call things limitations of studies. If we find that there was something that impacted the outcome that we had not taken into consideration. Developing research questions about clinical problem considerations. So can we propose questions actually to be tested empirically? So some questions are theoretical and philosophical, and they can't be tested in the real world. So is there sufficient knowledge that already exists? So can the questions be answered through basic problem-solving skills, or do we need to review the current literature, to do a review of literature to determine what is known out there, what is missing, and what are the gaps that we're going to address? So that's how we're going to come up with the research problem. In the research process, the appropriate method to address the problem. So is the rigorous scientific process of research necessary and appropriate for the question, or can it be answered in other ways, such as problem solving or nursing process itself? Because it's a very rigorous process, and as well, it's costly. So when we look at a problem statement, it comes from the research problem. So the problem statement formally identifies what issue we're going to be looking at for the study. And it includes the population of interest, the independent and dependent variable, and the goal or question that the study seeks to answer. So that's what you're looking at in the problem statement, okay? So if I were to give you an example of a problem statement that was lacking the population, that would not be formulated properly, correct? The purpose statement derives from the problem statement, and it says, what is the aim of the study? So first we're talking about who is our population, and what are the variables that we're going to be looking at. Remember, independent is the variable that impacts the dependent variable, right? Okay, so the research question is going to flow from the problem statement and the purpose statement. So the research question flows and it tells us, so it flows from the problem statement and the study's purpose, right? So often it restates the problem statement in a question format. So here you see, a problem statement is a formal statement describing the problem addressed in the study. A purpose statement is a statement indicating the aim of the study. And the research question is an interrogatory statement describing the variables and population of the research study. So in the two research studies, the article on safety behaviors of abused women and the Orem article, you want to be looking at what is the problem statement, what's the purpose statement, and what is the research question. Are they stated properly? Are they there? So that's part of what you evaluate in a study. So the elements of the problem statement that you want to look at, that it should say the problem or the purpose, right, in a clear and concise manner. The problem statement is written in a declarative statement or formal question, which is interrogatory. A population of interest is clearly described. There's an independent and dependent variables that are identified. Empirical data can be derived from the variables in the population, something measurable outcome. An indication that study is ethical, right, that it doesn't violate anybody's rights. Indication that the study is feasible, that can actually be done, and that the study is clinically significant and relevant to nursing practice. So here are some examples of problem statements, purpose statements, and research questions. The problem statement: the use of alcohol by college freshmen contributes to alcohol-related injuries and emergency department visits at the state university. So that's the problem that we are dealing with, right? The purpose is to determine if brief screening and nursing interventions for alcohol use during freshman orientation reduces self-reported alcohol use, alcohol-related injuries, and emergency department visits among college freshmen at a state university. So the research question is now going to restate this. Is there a difference in the self-reported alcohol use between college freshmen who receive brief screenings and nursing interventions for the alcohol use during fall orientation and the previous class of freshman students who did not receive this initial? So what we're looking at is there a difference that's going to be between a group that's going to get screening and education as opposed to the group that was prior that did not get that? Okay, so that's the intervention. The intervention is the teaching, right? And the screen, there you go. Brief screening and nursing intervention. So that is your intervention. And that is the research question 2. Is there a difference in alcohol-related injuries and emergency department visits between college freshmen who receive brief screening and nursing intervention for alcohol use during fall orientation and the previous class of freshman students who did not receive the brief screening? So we're also here looking at the injuries, the alcohol-related injuries, and the emergency department visits. We're looking to see if there's a difference in terms of those who received the initial teaching and evaluation and screening and those who didn't. So developing a hypothesis. Remember, we discussed there are several different forms of hypothesis. And here we're going to talk about how to develop a hypothesis. So a hypothesis is a formal statement about an expected or predicted relationship between two or more variables in a specific population. So some studies have a hypothesis and some have a research question, and that the hypothesis is inferred from the research question. But you should be stating the predicted relationship between variables or define the variables in a manner that allows empirical data to be collected so that we can collect data, and so predicted relationships can be tested. Describe the study. So the criteria for evaluating hypothesis and research questions is, does the study have an explicit hypothesis or hypotheses, okay? Or does the study present a research question? A hypothesis are written as a concise present tense declarative statement that are directly linked to the study. For studies that have identified theoretical frameworks, which are both those studies that I've asked you to look at, one has a theoretical framework and one has a conceptual framework. Each hypothesis is derived from the framework, and each hypothesis clearly identifies the population and at least two variables that can be measured and empirically tested. So each hypothesis is going to state one directional relationship. So that tells me how I think it's going, whether it's greater or lesser between the variables, and or a rationale that's going to say why it's non-directional, just telling me that there's a relationship. So for studies that present research questions rather than a hypothesis, the research questions are concise, they're clear and specific. And the studies with research questions meet similar criteria to studies testing hypothesis with a clearly identified population, measurable variables, and a theoretical framework. So we need to be able to measure the variables. So when we're looking at an associative hypothesis, that is going to be looking at correlations. We're going to be looking at things that are going to be characterized in 4 different ways: an associative versus causal, simple versus complex, non-directional versus directional, and null versus research. So some hypotheses can fit into more than one category, but generally not. So associative relationship is a type of relationship such as one that one variable changes as the other variable changes. That's correlation. If they change simultaneous, if one goes up and the other goes up, that's a positive correlation. If one goes down and when the other goes down, that's a negative correlation. And if there's no association or correlation between them, there's no correlation. You're not going to see that. You're going to see scattered, as you see here on the slide. So an associative versus causal is associative means that the variables are related with one change and other changes in a predictable manner. So that's called the correlation. The variables covary. That means they're related in how they moved and vary together. When both variables move in the same direction, it's called direct or positive correlation. When they vary in the opposite direction, there's termed a negative or inverse correlation. Is one goes up and the other goes down, right? And when there's no relationship between the movement of the variables, there is no correlation. And the degree to which each changes is not exactly the same, but the direction is consistent in the same way. So what we're looking for in causal is we're looking to see if there's a relationship. No, I'm wrong. I'm sorry. In correlational, in associative, we're looking to see if there's a relationship. In causal hypothesis, we're looking at what one variable causes for the other. That the independent is causal. Remember, I said only experimental studies are able to be causal. They're able to say that the independent study caused the change in the dependent study. Okay, so so looking at the independent, which is causes the change in the dependent, right? The effect is influenced. An increase in weight causes an increase in blood pressure. An increase in job stress causes a decrease in job satisfaction. Simple versus complex, that describes the relationship between two variables only, that there are only two variables in the that you're studying. And complex is that there's a relationship of more than two variables. And directional versus non-directional refers to whether or not the hypothesis states a predicted direction of the relationship. I hope this review is helpful in terms of looking at the articles that you have selected right now as well, aside from the articles that I've assigned for this week. A non-directional states that a relationship exists between variables, but does not state what the relationship is. And variable X is related to variable Y. Okay, so it's telling me that it's non-directional, but there is a relationship between the two of them. And a directional hypothesis says that the nature of the direction of the relationship between the hypotheses. So as X increases, then Y also increases. So a simple hypothesis is a hypothesis that describes the relationship between two variables. Complex is more than two, and non-directional tells you that there's a relationship. So this table gives you an excellent overview with examples of each of these. So an associative is there's a relationship between the amount of self-esteem and adherence to diabetic diet in adolescents with type 1 diabetes. It's looking at the relationship that exists. Causal is increased amounts of self-esteem, increased adherence to a diabetic diet in adolescents with type 1 diabetes. Simple is increased amounts of self-esteem, increased adherence to a diabetic diet in adolescents with type 1 diabetes. And here, non-directional is just telling us that there's an association between the amount of self-esteem and adherence to the diabetic diet in adolescents with type 1. Directional, it's going to tell us which way it's going to be. Increased amounts of self-esteem increases adherence to a diabetic diet in adolescents with type 1 diabetes. Null means that there is no relationship. There is no relationship between the amount of self-esteem and adherence to a diabetic diet in adolescents with type 1 diabetes. And a research hypothesis is increased amounts of self-esteem increase adherence to a diabetic diet in adolescents with type 1 diabetes. So let me ask you, why would someone pay $1 million to do a research study to demonstrate that there's no relationship between something? To do a null hype, to look, why would they have a null hypothesis? Oh, I think I heard someone in the audience say, because if there's a drug study that's being done and people are saying that this drug causes heart attacks, causes MIs, that this company would want to spend a lot of money doing a research study so that when they did the study, they found that actually there was not an increased incidence at all in terms of myocardial infarctions, in terms of heart attacks. And so it would have a null hypothesis. Okay, absolutely. So what are variables? Variables can be a phenomenon that can be directly measured, such as pulse, hemoglobin. It could be a quality or a property or a characteristic that exists, such as self-esteem, socioeconomic status. And we can measure them with questionnaires and scales, these forms. Abstract concepts that require an indirect measurement. So those include constructs such as depression, quality of life, autonomy, empowerment, and they're measured with scales or instruments that have been developed to measure these constructs. And these have been tested for reliability and validity. So best instruments are validated. That means that validity and reliability has been tested. And we're going to be looking at the types of research studies, as we've discussed, that will test these scales, these instruments. So there are types of variables. There's independent and dependent that we've talked about. There's mediators, moderators, confounding, and extraneous. So the independent is that is a variable that's going to influence another variable, dependent or outcome available. Dependent variables are influenced by the independent variables. Mediators and moderators are intervening variables that affect the relationship between the independent variable and the dependent variable. So mediator variables, they account for how or why two variables are related. And there may be that maybe one or more mediators. And a moderator variable is an interaction variable that affects the direction or the strength of the relationship between the independent variable and the dependent variable. So they help to explain the differences in the outcome variable and the effects of the exercise program on an overall physical activity. So gender can be a modifier, like women showed a greater increase than men, right? So we could look at that. Gender modifies the relationship between the exercise program and the overall activity level. So confounders or extraneous variables, which we've talked about, those interfere or influence the relationship between the independent and the dependent variable. So when we're looking at different ways of studying a problem or a situation, we're going to have, there's similar processes that all involve different types of evaluation data. So it could be, there's research, there's evidence-based practice, and there's quality improvement. And there's different purposes and methods. So the purpose of the nursing research is to generate new knowledge in the discipline. It involves a very systematic scientific inquiry to answer a specific research question or test a hypothesis, and it's based on a scientific method. The purpose of evidence-based practice is to make decisions about patient care based on the best available evidence. the expertise of clinicians, and the values and preferences of patients and families. It integrates and translates the best possible care that we can be giving in terms of incorporating patient care problems, but thinking about patient preferences. We in the past have not considered patient preferences, and here we are, and that improves outcomes. And we use a step-by-step approach of asking clinical questions, finding and evaluating clinical evidence, integrating it into practice, and evaluating outcomes for the practice change. So quality improvement, that looks at a structured continuous activity that's designed to systematically improve the ways in which we care. And so it's about delivery of care. It's the process of care. So here it's focused in a system level change. So you're looking at, you're looking within a system, and you're going to be identifying how you want to improve the care. You're going to look at the problem. It could be workflow issues, efficiency, compliance with protocols and procedures. Like, how come I have one of my graduate students did a study on the incidence of CLEPSI in the neonatal intensive care unit, and there were protocols and procedures set in place to have decreased to do it properly, that hopefully it would be at the level of 0, and they were having increased incidence. So she actually did a research study, not a quality improvement project, in terms of looking at what was taking place, that people were not following the protocols and procedures. And then you want to use the process, such as this, to plan to do a study framework. So it's going to be, you're going to be looking at the issue that exists. It's a short cyclic process for testing change in the process. So what they're going to be looking at is developing a program to identify what's the issue that's there, what's taking place, and what needs to take place in terms of promoting a change. So when we're looking at evidence-based practice, quality improvement, and research, there are different purposes for it. And the different purpose is, research is to generate new knowledge. Evidence-based practice is to, as we just said, to have specific outcomes for patient care. And quality improvement is to make the changes at the systems level within the system to address the initiative. In terms of looking at the question posed, you want to, nursing research explores and investigates and tests hypotheses. Evidence-based practice is going to improve patient care through the implementation of the practice or the process change. And quality improvement is going to improve patient care outcomes through the implementation of the systems change that you're going to be developing. The beneficiaries, in terms of, in research, our body of knowledge is increased in terms of that. We're creating a community of scholars and clinicians. In terms of evidence-based practice, patients, healthcare providers, institutions where the project was conducted benefit, and quality improvement is the patients, healthcare providers, and institutions that were proposed was conducted. Excuse me. In terms of the methodology, research has whether it's quantitative or qualitative, it's quantitative has very clear systematic and methodological approaches using scientific method. Evidence-based practice is less rigorous methodology, such as the Iowa model that's revised. And quality improvement is less rigorous methodology, and it uses a Plan, Do, Study Act, the POSA steps to change a practice. Generalizable ability of the findings. It's applicable in similar populations to a research study. So for instance, if I'm doing a study on 15 to 17-year-old male diabetics with type 1 diabetes, my outcomes in my research study are only generalizable to 15 to 17-year-old adolescent males with type 1 diabetes. Okay, so it's not to all diabetics, it's not to female diabetics, it's not to older or younger diabetics, it's to that same target population. In terms of evidence-based practice, no, it is not generalizable. It's unique to the setting where you are and where you projected, where the project was conducted, and also quality improvement also is applicable to that unique system, the unit where you did that project. And oversight and patient protection. The institution has to, and research, you have an internal review board that is there, the IRB. They are there to protect the rights of the participants. We also, the government and any funding agencies that will fund research requires that there be an IRB to make sure that the rights of the participants are protected. In terms of evidence-based practice, they're the institutions where the project is being conducted. They look at patient protection and as well with quality improvement. In terms of participant risk, there's variable risks and benefits in terms of research studies. We know that research studies are done also on drug trials, and you always have to let people know what the risks and benefits are, but we know that very often, when all the other trials of medications haven't been successful, people will take something that they know has an increased risk because it also has the benefit of, please God, saving their lives or improving their care. In terms of evidence-based practice, there's none or minimal risk and quality improvement as well. Informed consent. An informed consent is required when you do a research study. In the evidence-based practice and quality improvement, it is not. So what are characteristics that exist? The internal review board is always needed for a research study. And usually for evidence-based practice and quality improvement, it does not. The ethical justifications, so you always have to look at benefiting looking at weighing the risks in terms of the societal benefit and individual benefit from the development of this new knowledge. In terms of evidence-based practice, it has to be considered as expected by the problems to improve clinical practice, and quality improvement also that is going to improve care. And the dissemination plan for research, there should be publication and presentation of material. In evidence-based practice, there's internal communication and presentation at conference, and as well a quality improvement. So the PICO question helps in terms of clinicians having specific answers to clinical questions. And as we had gone over this, it's really structured in terms of looking at the patient population, who's going to be the target population, the intervention of interest, and the comparison. It could be an either intervention or no intervention, which is standard care or usual care. And it's not always needed in the PICO question. And the outcome of interest, whereas what do you hope to achieve, the desired result of the intervention. So it has to be clearly described and measurable. And the time frame in terms of how much time do you expect it to be. And here are some templates that are set up for you, and also in terms of looking at the different types of questions that you're going to be asking in setting up your PICO question. You want to make sure that you keep it ethical, always making sure to maintain the rights of your participants. Remember, we talked about that, somebody's doing a study to see if you could turn somebody, less than every 2 hours, longer than every 2 hours. We know that that's going to cause skin breakdown, and that's not ethical. So we always want to make sure we're doing beneficence, right? And that we're always doing things to the benefit of the patient. We talked about some of the unethical studies that were done that certainly found out information, but it was not preserving the life or the care of the participants. You want to give priority to studies that have potential to generate significant contributions to patient outcomes, and you want to recognize the difference between ethical questions and researchable questions. So having gone over this, and you want to go over the other PowerPoints that we've done in class, now you're going to have more of an understanding of how to answer the questions on the 2 articles that I've left you for questions. I also have provided you with the reading guides to help with reading the chapters that were assigned for this week. And when you're looking at your research articles now, you're going to be able to incorporate this information in looking at your studies. It's been a pleasure. Please, if you have any questions at all, feel free to email me, and you could call my cell phone number, and I will call you back. I hope you have a wonderful day, and that you all did very well on your other exams, and that you're enjoying learning this information and seeing how you now have the eyes to be able to create this changes in healthcare in providing increased access and in quality care to your patients. You are the future of our healthcare.